Hi, I'm Rebecca. I'm one of the nurses here at Beacon Care Fertility. Early pregnancy can be a very anxious time for patients, particularly if you've experienced a previous pregnancy loss. We are here to offer you as much reassurance as possible. Once you have a positive pregnancy test, we will schedule you in for your early pregnancy scan. This is usually carried out between 7 and 8 weeks gestation, approximately 3 weeks from your early pregnancy test date. The pregnancy scan we perform is a transvaginal ultrasound, and you will require an empty bladder for this. The purpose of this scan is to confirm that the pregnancy is in the right place, measuring for dates, and we'd be hopeful to see a fetal heartbeat at this point. At this scan, we will give you images to take home with you, and we will discuss next steps in relation to your care and your medications. Essentially, at this point, we discharge our patients from Beacon Care Fertility. But don't worry, that doesn't mean that we won't answer any further queries that you may have or provide you with any additional prescriptions that you may need. It just means that you won't have any further scheduled appointments with us here. At this point, we advise you to register with your maternity hospital. You can either self-refer or your GP can do this for you. This is a good time to link in with your GP, as they will provide you care also with your maternity hospital throughout your pregnancy. As I previously mentioned, early pregnancy can be a very anxious time for patients. One very worrying symptom can be vaginal bleeding. It is said that vaginal bleeding can occur in 50% of pregnancies in the first 12 weeks. Although common, we understand how scary this can be. Often our patients are prescribed vaginal medications. These vaginal medications can cause some vaginal bleeding that can be noticed on wiping. It is extremely important that you continue these medications. Abdominal cramping is extremely common in early pregnancy, and also don't worry if you're not experiencing morning sickness, not everybody does.